a large number of biological and physiological factors which affect the absorption. How they are affect? Now see the first, route of administration. Route of administrations. It is very important factor. Some drug is not absorbed on oral routes, it is given by the injections. The first route of admission, this factor is very important factor because some drug not absorbed orally, but it is given by injection. Now the next, the acidic drug is absorbed in the stomach, and the basic drug is absorbed in small intestine. The second factor, physico-chemical properties, physical verification. Now second factor, the second factor, physico-chemical property of the drug, the size and shape of the molecule, solubility, lipid, water, partition coefficient, affect the absorption. Physico-chemical property of drug, see the first, size, shape of the molecule that depend upon the solubility. Small size, they are directly soluble. Big molecule take the soluble time. Water, lipid and the water partition coefficients affect the solubility. Lipids, oil and the water does not mix immediately, but they are using third substance, emulsifying agent. Emulsion, they are prepared water and oil and water. They are affect the absorptions. Next, for example, acidic drug. For example, see the acidic drug, their pH acidic, example salicylate and barbiturate. Salicylate and barbiturates the drug can absorb in the stomach, because it should this drug having the nature is the acidic, their pH is the acidic, and the stomach, all the acidic drug dissolve in stomach. The basic drug, example ephedrine, dissolve in the small intestine, because small intestine having the basic pH, and that all the basic drug can dissolve in the small intestine. Next factor, state of the drug. State of the drug. State of the drug, you know, the drug is liquid, solid, semi-solid, suspension, emulsion. The various form of the drugs is available. Now, how they affect the state of the drugs? For example, liquid are better absorbed than the solid. Do you understand? Liquid are better absorbed than the solid. The crystalline are better absorbed than the colloidal. Crystalloids are better absorbed than the colloids. Colloids is a big molecule. As compared to the colloid, crystalline is very small. That's why the crystalloids are better absorbed than the colloids. Example of the drug, Gresofelvin and aspirin. Are better absorbed than micro form of drug. Gresofelvin, this drug is having category the antifungal. Aspirin, it is analgesic. You know, the tablet of aspirin, put in the water, dissolve immediately. When you get Gresofelvin tablets, they are made by the solid, they are better absorbed than the micro form of drug. Micro, that is a big molecule. It is seen by naked eyes, and that molecular weight is high. That's why it take time as compared to the Gresofelvin and the aspirin. And aspirin is immediately dissolved in the water. That is the state of the how the drug affect the state. You know, the liquid, solid, semi-solid, various form of drugs are available. Now the next factor, concentration. It's a simple. High concentration of drug are better absorbed. Absorption is good. The factor is concentration is most important. Drug having low concentration, absorption is less. surface. It's very common. The large absorbing surface having greater absorption. For example, small intestine having the large absorbing surface, and hence their absorption is greater of the small intestine as compared to the stomach. See the length of large intestine, see the length of stomach. Stomach is very small as compared to the small intestine. Then small absorbing surface less absorption. Okay, how they affect the absorbing surface. Next, this is important, the rate of blood flow, how they are affect the absorption. Rate of blood flow. Now body having the various organs, then they having the various vesicular membrane. The absorption is high. Absorption is high. Those having the vesicular membrane. Is produce the rapid absorption. Example, absorption from sublingual root. Sublingual root is faster. Tablet placed below the tongue and the melt at body temperature, they dissolve in the body mucosa that having the vesicular membrane, and then is a faster absorption. How in the blood, they directly goes in the systemic circulation. Absorption is directly take place in the blood. That's why the faster as compared to the oral routes. Next, formulation factor. Formulation factors, so many factors are there. Particle size of the drug. For example, small particle size better absorb than the large particle size. Second, excipient. You know the excipients. First year, PH1 you have to study solvents. Different type of the solvent are required. Those are soluble, drug can soluble, but they are inert in the nature. It does not change the drug properties, etc. These are influencing the absorption of factors. and then they are influencing, they are helpful, influencing बढ़ाने के लिए, influencing the absorption factors, and it's determine the bioavailability. Is determine the bioavailability. For example of the drug, calcium and magnesium salt reduce the absorption of tetracycline. When the tetracycline combined with the calcium and the magnesium, they form a chelate ion complex. Chelate ion complex, and they directly affect the absorption, not absorb. Another example, common example, aqueous solution are better absorbed than the oily solution. It's a water soluble solution. Water soluble solution is aqueous, it's a oil. The aqueous solution is better than the oily solution. They are better absorption of the aqueous solution. Another factor, biological factors. Biological factor like the gastric motility, GIT, gastrointestinal tract, pH, and some presence of enzyme, enzymes, and diet component affect the absorption. These are the common factor. Biological factor means gastric motility, GIT tract, your rhythm, pH. The high concentration drug is immediately, you can see the pH, high concentration of the drug is, those drug having the acidic pH is better absorbed in the stomach. Those having in the basic pH is better absorption in the small intestine. Some enzymes are affected, some enzymes are prevented. These are comes under the biological. And the diet factor, diet component, which food you can take diet, how they are affected. For example, you can take the non-veg, it's a very hard to the digestion. It affect the absorption as compared to the vegetables, green vegetables. One remain now last. pH factor. Last, pH factor. Most of the drug are weak electrolytes. Most of the drug is having Ionization. Depend on totally pH. That is the most important factor. Having the weak electrolytes, their ionization depend on the pH factor. Totally is pH dependent. It should be pH dependent. You know ionization already in the 12 weak electrolytes. There is no need to explain. For example, lipid insoluble drug not diffuse through the membrane, not diffuse through the membrane can cause distribution of drug on two sides of membrane and their absorption of drug is different. Drug across the membrane, that is called the absorption, but in the pH is one side of the membrane. Now see the membrane, cell membrane. That is a drug is extracellular. Okay. Across the drug across the one side come here, the drug one side of the membrane and diffuse through the across the membrane. Their pH and their absorption is totally different, not same, not uniform. That's why the pH factor is so important. They affect it. For example, lipid soluble drug lipid insoluble drugs. Okay. Next should be the bioavailability. Just see the bioavailability in the factor, formulation factor, formulation, affection and the absorption is the bioavailability. Is determined what's the bioavailability. What is bioavailability? So many ways the definition is explained. The fractions of the administer of drug, the fraction of the administered dose of drug that reaches in systemic circulation. In chemically in change bioavailability. What do you mean by the fractions of the administer of the drug? Fractions means how much amount you can administer of the drug. Administer of drug. For example, you can take a tablet for 500 mg. That is a fractions. Then that drug is taken and that goes to systemic circulation. After absorption, drug reaches in unchanged form in the blood circulation. That is called the bioavailability. For example, the amount, fractions of drug means amount of drug administered. Amount of drug administered by orally. Now it's by orally. Drug can be administered. It's a buccal cavity means here is a mouth. Drug goes here. Some saliva is distracted. When you can take a tablet, keep for a few seconds in mouth, buccal cavity. Some taste is you are feeling bitter. Then goes to esophagus. Then goes to the stomach. Now in the stomach, here is a acidic is nature. Acid there, acidic in nature, and this drug dissolve. Some drug dissolve in the dissolve in stomach. In hydrochloric acid, you administer the drug orally for 500 mg, for 100 mg tablet. Some loss here 1%, some loss here 20%. It goes to stomach to, here is stomach to duodenum, then large intestine, jejunum, duodenum followed by the jejunum, then part of the small intestine is going, and here is reach the unchanged form, systemic circulation, unchanged form. For now, you can take the 100 mg tablet. See the losses: 1% in the cavity, some in esophagus +1. Here is a 20, and some in the intestine 4. How much? 1 plus 1 2 plus 20 22 plus 4 26. Loss of drug, and remaining drug out of 100 is goes to the systemic circulation. Means 100 minus 26, 74% drug reaches in the systemic circulation, and the bioavailability is the 74%. That is the bioavailability. The amount of administration means the fractions of drug administration that reaches in systemic circulation in chemically unchanged form is called as the bioavailability. Fractions means amount of drug administration those reaches in the systemic circulation. Simple language, the amount of drug is administered and those reach in the systemic circulation, that is called the bioavailability. And the diagrammatically is explained. 100% tablet you have to administer orally. This goes in systemic circulation, reaches unchanged form in the 74, and hence the bioavailability is the 74%. Parenteral drug having 100% bioavailability because drug goes in directly in the blood. Intravenous example, intravenous administration, drug goes in the blood through the vein में देने के बाद then bioavailability is 100%. This factor is so important. Okay. Bioavailability is important for the formulation. Poor formulation factor of drug may influence the bioavailability. These are affect. The variation in the bioavailability has been observed mostly the poorly soluble drug. But not the water soluble drug. It indicates that those are soluble drug, their bioavailability is good. Those are weak, they are poorly soluble. These drugs affect directly in the bioavailability. The reduction in the particle size increase the rate of absorption. That one factor affect the bioavailability. Reduction of particle size increase the absorption rate. Small particle size and the large absorbing surface area, absorption may be increased. Bioavailability has a significance, importance. Has significance or importance. A drug with low therapeutic index or where the doses need precise control. Precise control. Example: digoxin, oral anticoagulant, and hypoglycemic agent. Now see the bioavailability significance. Those drugs having low therapeutic index. Low therapeutic index, the drug is not safe in the critical conditions. Is the importance of therapeutic index. But those drugs having the low therapeutic index, but they need for the treatment, their dose should be controlled precisely. For example, digoxin is used in the cardiotonic. It is heart stimulator drug, directly inject in the heart, but their dose slowly administered, precisely controlled. Second, oral anticoagulant heparin. Example drug is the heparin, and hypoglycemic. Those drugs responsible decrease the sugar. Correct? Okay. Now these are the importance of the formulation. The next time we will discuss about the distribution of the drug and the metabolisms. Thank you.